Welcome to the Research Works podcast, brought to you in association with the Healthy Strides Foundation. Your hosts are Dr. Dana Poole
and Dr. Ashley Thornton, and we're here at the AusACPDM conference in Cairns, Australia, to interview world-leading researchers, clinicians, and people with lived experience
to support your practice in being more evidence-based.
Welcome back to the AusACPDM Research Works desk.
You did well there.
Hello, Dana.
Good. Hello again.
And hello, Professor of Occupational Therapy at ACU, Laura Miller.
Hello, thanks for having me.
Thank you for coming back.
Yeah.
You joined us in, I think, the second season of the podcast in long form, and now we're all here together in person. At the conference, which is very exciting.
Good. Exciting to see people face to face since Perth in 2020 when we all had to rush home.
Yes, I do think of that frequently, what that felt like. 2020 was
quite traumatic for people, wasn't it?
Yeah, it was the last event. And people got on the plane and we didn't see each other for a very long time.
For many years.
Yes.
So it's been a wonderful reunion.
It has been, hasn't it? No, it's been lovely. And last time we spoke with you, we were talking about Envisage families, and we've been seeing that roll out everywhere, really. I feel like I see it everywhere, which is fantastic. And so now we're going to talk about the next stage. There's so many stages with this, and I know that there's been so much collaboration that's been happening across many continents, it seems. But can you sort of tell us a bit about where things are up to at the moment, and we'll get into the work that you are presenting at this conference for?
Oh, wonderful. Thank you. Yes, Envisage stands for Enabling Visions and Growing Expectations. So lots of people wonder where we came up with the name for Envisage, but it really is about empowering caregivers raising children with developmental worries or concerns or disabilities to take a strengths-based, future-focused approach to their child and family. And really by participating in Envisage, we want families to feel confident and competent in parenting their children. We want to be connecting families to evidence-based resources and tools, and connecting them to a network of amazing service providers, but also peers who have shared experiences with them that can provide them with support and that really important sense of connection and belonging that families really thrive with when they're raising children with developmental concerns.
Gosh, that's so... It's just so vital. I feel like we've been talking a lot lately. We've moved very far, actually. You know, in the olden days, we'd be talking a lot about just murder milestones and hitting the milestones, and the assessments were very... it did not zoom out to look at the whole family unit. And there was such a focus on that. And then now we just have amazing resources that are available to support families. And this isn't just for children with cerebral palsy, is it?
No, not at all. So it's families who are in a caregiving role to any child with a developmental concern or worry. So the program, the Envisage Families and our Envisage First Peoples program is funded across Australia. It's fully funded, free of charge to any caregiver. And you don't require a diagnosis. You don't need to be in the NDIS. You can just self-refer. You don't need to be connected into services. It's really available to anyone and everyone in Australia, including people who are not permanent residents. So it really opens the opportunity to all people who might need support and connection to be able to participate in the program. And we have been very fortunate in receiving that funding to roll out Envisage after we did our pilot program through COVID, actually, which we did online. Our program now is run both online and face-to-face, so families can choose what kind of program they'd like to participate in. But when we did those initial studies, the pilot studies, we were really encouraged to see that the improvements that we saw in family parent-reported sense of empowerment, parenting confidence, family functioning, well-being, and those benefits that we saw immediately after the program were also then maintained at 3, 6 and 12 months after the program, which is really good to see that those benefits that parents report actually continue on into the future. And we also ran a qualitative study alongside all of our quantitative data collection. And I think that tells a really powerful story, because that's really where parents have talked about what Envisage has done, how it's changed the way that they think and feel and talk about their child with a disability, but also how they think about themselves, and really connecting back to that they are doing a good job, that they know their child best, that they're a really important, vital part of the team, and that their voice matters, and that there's this beautiful future for their child and family that enables them to think about all of the strengths of their children, about all of the things that they like to do with their family, with their friends, at school, in the community, and how that's changed over time for them, that actually 12 months after participating in the program, they're still actually thinking about and applying some of the things that they learnt in the program or thought on the program, but could actually then use, many, many months down the track.
Wow. I think that really speaks to how authentic the co-design process was that you and the team went through as part of developing Envisage, right? Like that, I've heard, yourself and Christine Imms and people involved with Envisage say, this is a program developed by families for families, and I think those results just really speak for themselves, don't they?
Absolutely. I sincerely think that the power in Envisage is that families spoke to us very early on about what they needed and what supports they needed and how they needed it, when they needed it and why they needed it. And then we went through that very extensive co-design period over a period of years. It wasn't a tokenistic once-off consultation. It was an iterative process of co-design, and we're very committed to now, even in the large-scale implementation of Envisage across Australia, we are constantly seeking feedback and going back through that process of co-design to constantly improve the program, to embed that feedback into the next version of the program. And one of the really important things has been about ensuring that the program's culturally safe for our Aboriginal and Torres Strait Islander families. Yeah. And we have co-designed our Envisage First Peoples program as well with Aboriginal and Torres Strait Islander families, and that program is a standalone program. But we've learnt so much in that process of co-design that we've been able to then embed into our families program. And that's been a really important and vital step to the next part of the program. So,
I love that because there's so much emphasis on co-design here. It's so vital, really, because when you think about the fact that, yes, there was a bit of data collection that happened during COVID, we didn't see that coming, yet moving on to doing telehealth became such a big thing. We actually need to keep making sure we're moving along with whatever is the way of communication, I suppose, and the way of access, and that changes constantly, isn't it? So to keep this really relevant for people, you do need to keep the process moving, and I imagine that has its challenges as well, that to keep reviewing that as well. But hopefully, with the foundations already set, it's not like it's a big pivot to move in a different direction if it needed to go in a different direction.
No, and we really do want to be responsive to the needs of families at the time, and in the place that they need services. And Envisage is co-facilitated by parent peers. So more than half of the staff who work on Envisage have lived experience of raising a child with a developmental concern or disability. So we say that Envisage has parents' fingerprints all over it, and that's really is how we have approached the program and continue to develop it. Yeah. And another example of that is that families told us, this is great, we're thinking about things differently, we're doing things differently, and then when we're going to our service providers, we're having conversations in a different way, and we're not being met in the way or with the same ideas that we've talked about in the Envisage program. And they said, so we would really like you to develop something for service providers. So what we've spent the last 2 years doing is co-designing Envisage for service providers, and that's an adaptation of the families program to really upskill clinicians working with families raising children with neurodevelopmental disabilities to think about these things in that way, and how we can work in partnership with families, in a true partnership with families. And so, yes, that's been a really exciting next iteration of
That's
the envisaged
great.
co-design.
That's so good. Because we need to make sure that as clinicians you actually know what resources are out there, that's one thing, but also to know what best practice is. And I suppose knowing what best practice is a challenge in itself. This morning there was a session that you were on the panel for, and it was facilitated by Rachel Byrne, also has been on the podcast before, and it was about early intervention, ask me anything. And there's a lot of talk around, I guess, what best practice might even be and how we even define that. And I know you're sort of looking at some work there as well. What are the developments there apart from Envisage for clinicians?
There's a lot of resources available for clinicians, and I think the important thing is having spaces like AusACademy to come together where we can learn together and have difficult conversations about some of the things that are challenging in our clinical practice, and how do we implement best practice in an environment that can be quite challenging, whether that be the political environment or the social environment or the funding environment that we find ourselves in. And so I think it's really important that we come together and share all the good work that is going on. And I think that good work is continuing now with the review of the best practice guidelines in early intervention, and Christine Imms and her team at the University of Melbourne is partnering with some excellent partners to lead that work around reviewing those best practice guidelines in early intervention. And so I'd really encourage everyone who's here at AusACademy and working in clinical practice across Australia to be part of that consultation and really be involved and be able to talk about some of the things that we know are difficult to implement, but we know is best practice and really serves the best outcomes for our families.
That's really exciting.
Yes. So, Laura, what's next for? I feel like Envisage is, as we've discussed, forever evolving and adapting to meet the needs of families, but also now service providers. What's next for Envisage and the work that you do?
Well, I think that Australia is a very large place, and we know that in order to be able to implement Envisage as a program and also the ideas across all states and territories really is about building capacity in local communities. So we have a lot of work to do in terms of training facilitators and building local community capacity so that Envisage is sustainable into the future. That's really important.
Yep.
And that includes going regionally and into remote areas and partnering with organisations that have good connections into communities. So that's an important next step.
Yep.
And we're doing that already, but like I said, Australia's a big place, so we've got a lot of work ahead of us. There's the partnering with our First Peoples communities across all states and territories. Every community is different and has different needs.
Yep.
And really we're working with local community champions around whether our First Peoples program is meaningful and relevant to them and what needs to change and how might that look in their community. There's the service providers program that we would like to see implemented so that all service providers that are working with children and families have access to this program and this community of practice where we can learn together, continue to learn together and support each other. And then there is a lot of international interest for Envisage as well. So translating Envisage into different languages. So we're doing that in Australia already. We're partnering with Community Hubs Australia, and we're doing translations in Vietnamese and Arabic at the moment. But also we have partnerships in Croatia and Denmark, and lots of interest globally around what Envisage might look like in different cultures and diverse languages. So that's another piece.
So brilliant. It's just so brilliant.
Lots to keep you busy.
Yeah. And there's lots of things. We've had great conversations as part of this conference around empowering young adults with disabilities and Envisage for young adults and what that might look like, and Envisage for kids and what might that look like, and Envisage in early education. And so there's a lot of opportunities, and I'm really keen to hear from people that are aligned with the Envisage values, because I think there's a lot of good work that we can all do together.
And I think that that all comes about because you have such clarity on what the key ingredients of Envisage are, and how that is important to families, and so you can be adaptable and flexible with the implementation of a program like that when you are so confident in, you know, what it is that you're trying to achieve. So congratulations.
Gosh, amazing. That was just inspiring to hear you talk about all of that. Absolutely wonderful. So congratulations, body of work. Thank you for spending time with us here today at the conference. It's a jam-packed conference, so thank you for spending time with us. Yeah, absolutely amazing. So to everyone else, I hope you enjoyed that as much as we did, but there's still plenty more to come. So we'll talk to you all again really soon. Bye.
Bye.